We know that the human body has a vast circulatory system with the heart at its center. The arterial and venous systems can be superficial and deep. In this section, we will talk about the superficial veins of the upper limb. Superficial veins of the upper limb assume importance in medical practice because these are most commonly used for intravenous injections and for withdrawing blood for testing. This is done by placing a tourniquet. The tourniquet is applied 3 to 4 inches above the needle insertion point. Here you can see the veins of the upper limb and their tributaries. Most of the superficial veins of the limb join to form 2 large veins, the cephalic and basilic. The cephalic vein is the preaxial vein, while the basilic vein is postaxial vein. Some points to keep in mind here is that the superficial veins are absent in the palm, that is the fist area, along the ulnar border of the forearm, and in the back of the arm and trapezius region. This makes the course of the vein spiral from the dorsal to the ventral surface of the limb. But wait, did we already discuss what is meant by pre- and postaxial? We have already talked about the anatomical terminologies in our previous video. The term preaxial is an anatomical terminology. With respect to the upper limb, it means the radial aspect. It is the side where the radius bone is present and the side of the first digit of the hand. Remember, radius is right on the right arm. It lies cranial to the axis of the limb. As for the term postaxial, you may have already guessed it. It means the ulnar aspect. It lies caudal to the axis of the limb. Coming back to the topic at hand, the superficial veins of the upper limb. The preaxial vein is longer than the postaxial. In other words, the preaxial vein drains into the deep axillary vein more proximally, at the root of the limb, than the postaxial vein, which becomes deep in the middle of the arm. The earlier a vein becomes deep, the better, because the venous return is then assisted by muscular compression. The superficial veins are accompanied by cutaneous nerves, which we discussed in the previous section. It is also accompanied by the superficial lymphatics, and not by arteries. The superficial lymph nodes lie along the veins, and the deep lymph nodes along the arteries. We will talk about the lymph nodes in detail in the next section. Now, if we look at this simplified figure showing the superficial veins of the upper limb, we will look at the superficial veins of the arm in ascending manner. That is from the hand towards the head. First, we have the dorsal venous arch lies on the dorsum of the hand. Its afferents, or the tributaries, include the 3 dorsal metacarpal veins are shown here, which contribute to the formation of the dorsal venous arch. Next, we have a dorsal digital vein from the medial side of the little finger, and a dorsal digital vein from the radial side of the index finger. Lastly, there are 2 dorsal digital veins from the thumb. Most of the blood from the palm courses through veins passing around the margins of the hand, and also by perforating veins passing through the interosseous spaces. Now, if we move upward, we see the 2 main superficial veins of the upper limb that we mentioned before. If we look from the front, here we have the cephalic vein. The cephalic vein is the preaxial vein of the upper limb. It begins from the lateral end of the dorsal venous arch. It runs upwards through the roof of the anatomical snuff box, which is an important anatomical landmark of the hands, and winds around the lateral border of the distal part of the forearm. It continues upwards in front of the elbow and along the lateral border of the biceps brachii. After that, the cephalic vein pierces the deep fascia and the clavipectoral fascia and joins the axillary vein. It continues upwards in front of the elbow and along the lateral border of the biceps brachii. After that, the cephalic vein pierces the deep fascia and the clavipectoral fascia and joins the axillary vein. At the elbow, the greater part of its blood is drained into the basilic vein through the median cubital vein, and partly also into the deep veins through the perforator vein. It is accompanied by the lateral cutaneous nerve of the forearm and the terminal part of the radial nerve. An accessory cephalic vein is sometimes present. It ends by joining the cephalic vein near the elbow. Now let's talk about the basilic vein. The basilic vein, it begins from the ulnar side of the venous network on the dorsum of the hand. Basilic vein is the postaxial vein of the upper limb. It ascends along the ulnar side of the forearm, first on its posterior aspect, and then winding around the ulnar border to reach the anterior aspect. Crossing in front of the medial part of the elbow, it runs upwards along the medial side of the biceps brachii muscle. At about the middle of the arm, it pierces the deep fascia and comes to lie medial to the brachial artery. It ascends in this position up to the lower border of the teres major, where it becomes the axillary vein. About 2.5 centimeters above the medial epicondyle of the humerus, it is joined by the median cubital vein. It is accompanied by the posterior branch of the medial cutaneous nerve of the forearm and the terminal part of the dorsal branch of the ulnar nerve. The last two superficial veins are the median cubital vein, as mentioned before. It is named so because it lies in front of the elbow joint, and the median vein of the forearm along with the palmar venous plexus. The median cubital vein passes upwards and medially from the cephalic vein to the basilic vein. It is often the largest vein in the region, and is frequently used for taking blood samples or for giving intravenous injections and blood transfusions. The palmar venous plexus is drained by the median vein of the forearm. This vein ascends on the front of the forearm and ends in the basilic vein or the median cubital vein. That concludes our discussion on the superficial veins of the upper limb.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.